This podcast is made possible thanks to the generous support of Association Member Benefits Advisors. AMBA, formerly Mercer Association, helps support the practice of medicine by offering best-in-class insurance plans such as workers' compensation, life and disability that meet the needs of physicians, your families, and practices. AMBA is LACMA's sponsored insurance broker and administrator, supporting LACMA members for more than 25 years.
Hi, everybody. Thank you for joining us for this episode of Clear as Mud. I'm Dr. Omer Deen, president of the LA County Medical Association, and we're here at the UCLA Luskin Center at the Healthcare Burnout Symposium. I'm honored to be here with our guests today. I have Dr. Sapna Shah-Haque and Dr. Katie Cole, who are joining me today. Thank you guys for being here.
Thank you for having us.
First off, where are you guys from? Where's home base?
Kansas.
And originally Kansas, but now San Francisco Bay Area. Okay,
so this is funny. I'm going to go off on a little bit of a tangent here. I grew up in Kansas City. My mom and dad, my brother, his family, they all live in Kansas, Independence, Missouri, to be honest.
They're right outside Kansas is where I'm from.
I got a lot of buddies still in Leawood. We chat all the time whenever we go back home.
So
Small
we've got
world.
We've got the Midwest vibe going today in LA.
That's right. Very cool. Okay, so just kind of, what are your thoughts of the symposium, how it's going? Have you felt, what are your kind of key takeaways so far?
Wow, well, I am just impressed with the turnout. We have a great group of healthcare leaders and stakeholders, physicians, nurses, a lot of great questions, really good interactions from people. And I am really impressed with our speakers as well. And really what I've noticed is that everyone is practicing being vulnerable as a leader and sharing their own story, which really makes a difference. And in this conference, we're really focused on solutions and what is evidence-based and what are we doing to try to heal our national healthcare system. So that's been my takeaway so far.
I really like the ingenuity and the authenticity of the participants as well as the speakers. So to me, we both had losses, and that is really what drives us to be here. So there are other people that are as passionate about burnout as we are. And when you get all that synergy and that energy in a room, it's overload in a good way.
Yeah. I agree. And actually, that's been a recurring theme. I've been kind of walking around talking to a lot of the people here at the symposium. And what I'm hearing repeatedly is that, we have these little silos wherever we work where there's 2 or 3 people and we kind of get it and we talk about burnout and we talk about these things. But what feels really good is being here collectively all together. Everybody's on the same page. We're all trying to combat burnout. We all know what this can do and what it does to us as providers and as people personally. So I think that cathartic sort of healing that occurs, getting to know each other, talk to each other, sharing our stories is just fantastic. So I want to get into that. Sapna, if we could start with you, just kind of what experiences brought you to kind of center burnout?
Sure. So I've experienced burnout twice myself, in 2016 and then 2019. The catalyst in 2019 was the death by suicide of my best friend from medical school and residency.
Oh, that's horrible.
One week you're planning a wine night, and then the next week it's a celebration of life. That messes with you.
Yeah.
And so, what do you do with that? And after thinking about it for about a year, got into therapy and was looking for another way to really what to do with that pain. And so started podcasting, started writing, started speaking. And it's just, we have to bring awareness to physician suicide. We have to bring awareness to everything that's going on. And in her letter, Dr. Bicker did say that she did not seek help and she minimized her symptoms because she was scared of professional repercussion.
Yeah.
So, we're not allowed to be human because of the questions we are asked and we have to answer truthfully on a licensing questionnaire every year. And I get it, but we treat depression, but yet we're going to be dinged if we have it.
Mm-hmm.
That's not right. So, silver lining, Kansas did change those to one question, and so now it's, do you have X, Y, and Z, and does it prevent you from practicing medicine, or does it impede your ability? So there's a big difference. That's a win.
Absolutely. And the key part there is this something that you feel is going to impede your ability to practice medicine safely? That's the key. And,
correct.
And it wasn't like that before. It was simply like you're admitting to something that will be used against you. Absolutely. And that's still the law in so many states, and not just state licensing, but hospitals and hospital privileging, where your peers are seeing this and reviewing this. So I've heard of a lot of, my colleagues that say similar, that, hey, look, I don't want it out there. I don't want people to know. It's going to affect my liability insurance, my malpractice. It's going to affect all kinds of things.
But the good news is I think there's over 13 states today that have been working on their credentialing languaging. And if anyone wants that information, you can go to the Lorna Breen Heroes Foundation, and there is a toolkit that you can download, so you can take it to your own credentialing system at your hospital, healthcare organization, or your medical board.
That's fantastic.
Yeah.
Tell me a little bit about, now you have, I'm so proud to know about this, but you have really dedicated your career to this. Can you tell us a little bit about that?
Well, yeah. So I'm a psychiatrist by training, and, I think that it was a culmination of events that happened to me, both professionally and personally. I was at a healthcare system and doing all this work for them, building a mental health programming throughout the entire system. And I was told that I was too young to be a leader. And so I was demoted. And at the same time, I also lost my father to suicide, and he was an oral surgeon, and he also was afraid to get help for his treatment out of fear of not being able to continue to practice medicine. So I had my grief around the loss of my father and what was happening at work, and I think everything just really culminated into me having depression and developing PTSD from all that. So I really dove into personal and professional development. I thought about rehabbing my career and doing more like integrative holistic medicine and getting out of healthcare, the administration piece. But what I found is that even though I was trying to avoid being part of the healthcare toxicity, it was really hard to separate myself from that. And I was still engaging with the healthcare community. And so I got back into leadership to try to make a change. And in my leadership roles, I realized how toxic healthcare was even becoming over the past 10 years. So I decided that it's time to dedicate my career to really making a change nationwide and making an impact for everyone, because we are all suffering as physicians. And I've lost colleagues to suicide. I lost my father to suicide. I myself was having suicidal ideations at times through that episode. And so it's really, we need to come together as a community. And part of that means being vulnerable and sharing our story so we feel empowered to move beyond that.
Absolutely. That's just, the thing that really sticks with me through your stories is when you take something that's so painful for yourself and you're able to turn that around and use that to energize you and to do things like this that are impacting so many lives, so many people's careers. I mean, that's really commendable. Thank you so much for sharing that.
Well, thank you. Thank you for allowing us to share our stories today.
Of course. Oh, thank you for being here. What are kind of some of the things that what are you hoping to take back from here to your institutions? Like, what are kind of one or two key things that you can, like, that you think would be useful with your peers who weren't able to attend?
So I have a bit of a unicorn position. It's taken a couple moves to get there. But, how do we recruit and retain? And so what I really, really liked were some of the thoughts, and especially Dr. Diane Shannon's workshop yesterday, I think was phenomenal. as well as yours as well, because but it gives you tools. It gives you tools like, okay, this is healthcare, this is a future of medicine, and this is the projection. So if this is the population that we're going to be working with, how do we recruit those individuals? Especially, I'm in rural Kansas, so how do we recruit them to rural Kansas? How do we retain them? And so if you can really, really augment that, and then use the language that the young physicians or younger physicians are looking for now, I think that's huge. And that's going to have a big impact on a rural community.
Absolutely.
Thank you for sharing that, Sapna. And, I think every healthcare organization, clinic, system is at a different stage with organizational well-being. And so one of the healthcare systems that I'm consulting with now in Northern California, they're at the stage where they haven't even recognized burnout, and they're not even looking at it for their healthcare system. So I gave a presentation last week on leadership to the entire healthcare system. And what happened out of that is 3 different doctor groups, including medical students, residents, and attending physicians, decided to form individual wellness task forces. And so I'm going back to talk with them on how to get started and how to build a business case with accounting for organizational well-being in healthcare, and then how to present that to leadership. So then there's a plan moving forward, and leadership has a sense of the return on investment for their turnover.
That's fantastic. I mean, these are the kinds of things that I think are going to be a huge draw. I was thinking about this while you were talking about recruiting to rural Kansas, that to offer something like this that most hospitals and organizations are not doing, to address this off the bat, that look, we're here for you, we're a team, we will support you, and here's what we have to back up what I'm saying. I think that's huge. I think that's going to, maybe from that standpoint, maybe from a recruiting and a business standpoint, hopefully this will spread to other organizations. So it's fantastic. Man.
Well, that's what we hope too. And there's been a lot of great discussions about, oh my gosh, what can I do for my own organization? Or I'm just an ER doctor and I'm just learning about these concepts today, that we can make a difference and that we can have a culture of well-being in our organization. So where do I begin? And so I think this is a great conference. It doesn't matter what level you're at, because I've also had conversations with CEOs and chief medical officers as well that are learning things at this conference about what they can take back to their own organization to implement in their programs.
And I was actually heartened to see that we have a lot of administrative people that are attending this conference. We've got not just physicians. It was initially aimed at physicians and healthcare providers, but now we've got, CEOs, we've got people, we've got accounting people, we've got lawyers here, like people that are really trying to understand this so they can take that knowledge back. So can you speak a little bit more about some of the things that you guys are doing? I know that I was a little nervous talking to you guys because you guys have some experience with podcasts, right? So tell me a little bit about that.
Sure. So I have the Worthy Physician podcast. You can go to www.theworthyphysician.com. Have some of tools that I've created myself just out of what I've learned. Have been podcasting for a couple years now. It's a passion. It's cathartic for me, and I also learn from the people I interview, and just discussions are fantastic. And then also I helped to co-author a book, Thriving After Burnout. So it's over 50 women have collaborated, including some that live here in the LA area. And so I think that it's just normalizing the conversation. Like, we as physicians are humans, and let us be humans. And when we embrace the craziness and the messiness, kind of like a toddler, we realize that, life can be fun, and so can medicine.
That's right.
That's a tough one to top.
Oh, that's wonderful.
Well, I am Katie Cole. I have a podcast called Hope for Healthcare, and you can access that on my website. That would be www.drkatiecole.com. And you can pick what form you want. I do shoot a video podcast, but it's uploaded on Podbean for audio formats as well. And really, I launched my podcast for both personal and professional reasons. It's an outlet for me. It's a creative process. I love learning about new solutions in healthcare and what healthcare systems and organizations are doing. I also love learning about the tech industry as well and different players in medicine, including the payer system, and how they're concerned about the mass, exodus of physicians and nurses. So it's been very inspirational for me to do that and to share these best practices for everyone. My other passion, of course, is mental health advocacy in our country as a psychiatrist, and formerly having my own issues with depression and PTSD and in the family and my friends. It's very important for me to make sure we have equitable access to mental health care nationwide, especially for healthcare workers and employees. So that's my other passion.
Fantastic.
Yeah.
Well, I can tell you it's inspirational, and I'm so happy to meet you guys. I think this is one of the best parts of a symposium like this is you make friends, and we'd like to partner and work together more in the future with the LA County Medical Association. We've formed bonds across the country, and we're really excited about that. So thank you for joining us and for your time.
Thank you. And if you're ever out in the Kansas City area, please let us know.
Oh, absolutely. Absolutely. I'm going back this year.
Dr. Deen, thank you so much for having us on your podcast and for collaborating and sponsoring our Burnout Symposium. It's been a real pleasure having you guys around, and we look forward to future collaborations as well.
Thank you. Dr. Shah-Haque, Dr. Cole, and we hope that you'll join us for the next episode of Clear as Mud. Thank you.